Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, Health Education Specialist and Physician Assistant. Some of you all maybe know me as Dr. O, the Health Ed Pro. I wanted to talk briefly about the mask with this whole Covid-19 pandemic. Unfortunately, it's been made into a political issue, like a lot of other things, race, various other movements. You've got, again, us humans dividing ourselves into groups. You've got the non-maskers fighting for their rights, and the maskers fighting for their rights. We're seeing these videos on social media that go viral of people yelling when they're in places because they either have a mask or don't have a mask. People are yelling at them or they're yelling back at people. Again, it's us humans being humans. We have to fight about something. I think it's in our DNA, unfortunately. But I try to consider myself a centrist because I'm a clinician and an educator. So I have a responsibility as well as an accountability to try to give the most, just ran 9 miles, so I'm sweating. It's 80 degrees now. I have to give, as a clinician and an educator, degreed, certified, and licensed, I have to give information that is accurate. People ask me, families and friends and coworkers, how is COVID spread? Is it on those boxes of cereal for 72 hours? Is wiping your products down with bleach cloths help? Does quarantining yourself from your family if you're a first-line hospital worker, does that help? I don't know. There's a lot of research that would suggest that it doesn't matter. There's research that argues that it does help. I don't know. For me, I think the least I can do is wear the mask. Now, my son and I just did our Friday run, so we did 9 miles. It's hot. I hate wearing this mask. I'm writing something now about mask fatigue, because I've got these rashes behind my ears from the mask, and even if I tie it behind my head, I don't like the way it feels on my head. When you're running and the mask gets wet with your sweat and your water, it becomes non-porous. It's like having somebody's hand over your face or a plastic bag. It's very difficult to breathe. But I figure that's the least I can do. The least I can do is wear the mask. The least I can do is practice social distancing. And I know there's YouTube videos out there. There was a doctor talking about, the 6 feet or so people, when they come to call the herd, when they quote unquote come after us, and the snipers on the rooftops are using the infrared goggles, they'll be able to distinguish us apart because we're 6 feet apart. It'll be easier to pick off. The mask depersonalizes you, so you're easier to kill. I don't know anything about that. I cannot go by conspiracy theories. I have to go by science. That's the responsible thing to do. I have a medical license. I've been practicing medicine as a PA for 20 years. I've been a health educator for longer than that. I'm very passionate about it. So I have a responsibility to give information that's accurate, that's based on science. I have a master's degree with a specialization in infectious disease. I took care of folks with HIV and STDs, hepatitis C for many, many years. I'm a hospitalist now. Many of my patients have had COVID, and thank God, alhamdulillah, have recovered. So I'm out there in the field seeing the devastation of this disease. I'm also seeing that people are recovering from it. But I have to be responsible because I'm held to a certain standard. Those of us that have medical licenses and are considered educators and have certifications and license in this. We have to be held accountable to that. We can't just say stuff and put stuff out there. Everybody has an international soapbox upon which to stand now with the advent of mass media. Uh, so everybody becomes an expert. Forget what Dr. Fauci says. He doesn't know what he's talking about, even though he spent many years. He's one of them. This is what you hear. We have to go by science. Now, I'm a man of faith. I believe that, inshallah, Allah, the Lord will get us through this, and there'll be some other thing, some other challenge for us. But I have to go by science. So I wish you guys the best of success in your positive endeavors. Try to wear your mask when you go out. Wash your hands. Practice social distancing. I think we're going to get through this, God willing, inshallah. Okay, please subscribe if you feel like it. You can reach me on Instagram also. Take care. Peace.